Whatever sort of a birth she's had, every woman needs time to recover after her labour. However, women who have had a very long labour leading to them being exhausted, or assisted birth or a caesarean birth, will probably need longer than women who've had a straightforward birth journey. In the Western world, we expect women to bounce back very quickly after birth and sort of get back to normal, but that's quite unrealistic if she needs to rest. So by rest, what I mean is that she has the opportunity to stay in bed for as long as she wants to, having her meals brought to her, having her baby with her so her baby can feed when he or she needs to, and mum can sleep whenever they want to, receiving your visitors in your bedroom so that they don't stay as long and tire you out and you're not tempted to get up and make tea for everybody. So the more that you can rest after the birth, the more likely you are to get better quickly. And if you've got your husband or partner there with you at home, then they are able to look after you and keep you well in those early days and weeks. Realistically, for most of us, once our partners have gone back to work, then the need to get up is greater. But if you can rope in other people, your mum or a sister or whoever, to come and be with you for at least bits of each day so that you can go back to bed for a while, then you'll probably find that you get better much more quickly. For mums who have had stitches, they are likely to be in a great deal of pain in the first few days after birth. But they can help themselves by using cool packs such as a bag of frozen peas or a sanitary towel with some witch hazel put on it and then put in the freezer to help reduce swelling. The homeopathic remedy arnica can also be used for those who like to use complementary therapies, as that is good for bruising. Doing pelvic floor exercises can help the blood flow to the area to help with healing more quickly. Using a nice warm bath with a few drops of lavender or tea tree oil, which both have antiseptic and antibacterial properties, can help for mum to feel a little bit more comfortable. And talking of comfort, particularly for breastfeeding mums, they're going to be sitting for long periods of the day feeding their baby, and it may be very uncomfortable to sit. So finding ways to sit comfortably, or perhaps lying down to feed your baby so you don't have to sit for quite so long. The other thing to think about for breastfeeding mums is the fact that breastfeeding is in itself a very physical activity, burning many hundreds of calories a day. And if you are recovering from labour, then you also need the time to rest in order to give your body the energy to make the milk. So you'll make more milk and your breastfeeding is more likely to be effective if you rest well in the early days.